So prostate, I have some tremendous issues, as I said, so I personally believe that every man, this is my own personal belief, starting at 35 or 40, maybe even 35, should have a PSA, which is a blood test. Now, why is that? Everything we've told you so far is an invasive test, and there's risks. A freaking $2 blood test, zero risk.
Yeah.
Okay. So, PSA. So the argument that the U.S. Preventive Task Force, who I told you I don't like, they're much more strict than the American Urologic Association. They say that PSA is unnecessary because it leads to further downstream testing. Okay.
Well, there's a high false positive.
Right. Okay. But let me just tell you, so if there's 10 deaths, 20 deaths, 100, 1,000, there's 35,000 men that die of prostate cancer. Okay. Number 2 killer of men. So I don't want to hear any shit from anybody, excuse me, that I'm going to, not get, that it's going to lead to further downstream testing. So, basically the guidelines say that you should probably get it regular screening at 50 to 55. I don't buy it.
Yeah, they have to change that. I mean, I've been getting it forever. Like you say, whenever you get blood work, we all get blood work, right? Once a year, hopefully. Right. Just get a PSA if you're a guy. Right. It's not a big deal. It's an easy test to get.
Right.
And, but the guidelines do say 50, and then with a history 40, but.
Right. And what's even stupider is that they recommend that anybody over 70, and you're like, does not need it unless their estimated lifespan is greater than 10 to 15 years. So you're like, it's crazy. So you're 70 and you're like, am I going to live? Right. Am I going to live am I going to make it to 80 or 85? If I am, then maybe it's necessary, maybe it's not. So,
well, the average age of getting prostate cancer, I think, is late 60s anyway.
Right.
67, 68. So, just get the PSA, and then if you get your annual physical, they can pick it up on a rectal exam too, potentially, but that's more unlikely. We get the PSA. If the PSA is elevated, then you need further workup.
And I mean, I've never felt one on a rectal exam. My fingers weren't that long, but that was a joke.
Yeah.
But it's you get a PSA. Does it lead to a biopsy? No, absolutely not. Because my dad died of a type of blood cancer, but his PSA was 18, and I sent him to USC. I have a fondness that's where I do my general surgery, but they have the finest urology program, I think, in the United States, and they were able to actually milk prostatic fluid and do circulating tumor DNA on his prostatic fluid, and he did not have cancer, and he did not need a prostate biopsy. And I know Mike has other friends. We talked about in whole body MRI that guys are having it done in the Pronovo and stuff because they're looking for prostate cancer, and it does not, that specific test, whole body MRIs, does not find early prostate cancers. You have to have a special MRI, just like when you have a breast MRI. Let's say you have a mammogram, dense breasts, and they're like, oh, you need an MRI afterwards. It's a special MRI.
Especially not prostate, correct?
Right. So,
but I believe that's very sensitive. So I do know one person in particular that does do that every other year to make himself, sleep better. I guess he's got a family history of it, and he doesn't want to rely on the PSA. So.
Okay, that's being a little neurotic. No urologist. Certainly your insurance is not going to pay for it, but right. No urologist is going to say, so, recommendations are, as Mike said, screening 45 to 70. If you're less than 40, you should have it done if you have a family history of it, or if you're African American, okay, because they're higher risk. But like I said, it's a blood test. Who cares?